Hi, so I'm going to put the link to the article that I'm referencing in the comments here, but I'm just going to talk to you about an article that I got from functionalmedicineuniversity.com today that I was looking at and just found to be interesting and would be a great tip to share with you all. So if you're anything like me, you just worry about your blood pressure, and it has to be something that you're constantly just working on and aware of and working to improve so that it doesn't get out of control and so that you have good heart health. And I think most people worry about that, but especially in my family, we have a history of that on both sides. So I tend to have a higher blood pressure anyways. My friends are all sitting at these like beautiful 110/70 numbers, and I'm like 120/80 is a good day for me. It's always been my normal, and I have to be really careful. So one great way to do that obviously is to stay active. Another way is to keep your sugar intake low, your carbohydrate intake low, and your healthy fats up. Bad fats low, sugars low, healthy fats like nuts and seeds, avocados, olive oil, coconut oil, animal fats that are from grass-fed animals in moderation, and grass-fed butter sources are going to be really, really good to help your heart health. So, but the little tip that I'm going to talk to you about today, anyone can start doing at any time. So you can literally do it right now while I'm talking to you. And studies have shown that this helps your blood pressure go down by up to 20 points. And even in a really healthy population of people, the numbers went down by about 10 points, or at least 7 points on the diastolic blood pressure. So first of all, blood pressure, systolic is the top number, and diastolic is the lower number. It used to be 120/80 is what they would call normal or a healthy blood pressure. Now I do think they've moved that down to about 110/70, but it's kind of arbitrary, right? You just have to have a healthy heart, and either way, as long as you're shooting for those lower numbers and making the changes, that's what's really important. So my tip or trick for you right now is to do isometric exercises. So when we usually think about, well, I need better heart health, I need to start running, or I need to go to a fitness class, or join a CrossFit gym, or like something that's just a really big step for you. If you are sitting there and haven't really had a gym membership before, and that really intimidates you to think about, and you're not sure that would be a good first step for you, that's probably good that you're thinking that way, because you don't want to just step from nothing to something that intense. So this is something that you could do right now. So isometric exercises are when you contract large muscle groups, but you don't actually move. So one of the first examples of this that's really popular, but it's actually one of the more advanced exercises, is like a plank hold. When you hold a plank, where you get on your elbows and have your legs behind you and you're in a push-up position and you're holding it, like I said, it's one of the more advanced moves, but you are activating a lot of your big muscle groups, your whole core in your front. You're activating your chest and your shoulder girdle muscles, probably activating your glutes and down your legs. So these exercises in several studies have been shown to lower blood pressure. So one example of this that you could do right now is squeezing your thighs together. So your inner thighs are often like underworked, and I'm doing it right now and you can't even tell. So like, as far as you guys know, I could just be at work having another day, but I'm actively squeezing my inner thighs together really, really hard. And you can just count to about 10 and then relax. And if you keep repeating that throughout the day, the studies, one of the studies that was done had people doing 3 times a week for about 15 to 20 minutes total. And they did that 3 times a week for 10 weeks. And at the end of 10 weeks, their systolic blood pressure, the top number, dropped by about 10 points, and their diastolic blood pressure dropped by about 7 points. So these people were doing 2 minutes of holding, so 2 minutes of inner thigh squeezing, and then 1 to 3 minutes of rest time. In another study that had way better results, these are the ones where people were dropping by up to 20 points and everyone was feeling great, and it wasn't, it was a wider age range as well. They were doing 5 rounds of holding for 3 minutes. So if you can hold for 3 minutes and then rest for like 3 to 5 minutes in between and do that 5 times, that's going to total about 15 minutes of holding, and then the rest can be in breaks. And you can do this throughout the day. So that is going to slowly start lowering your blood pressure. In one of the studies they did, they actually had, they were trying to figure out how to get pilots in fancy planes, because I don't know that much about planes and I don't have the study right in front of me, but they were trying to get them to not pass out because of all of the G-force that they were coming, that was happening, whatever. So anyways, they would have them grip something really tight with their hands to try to get them to stay awake. And then after they had trained people to do this, people who practiced doing that regularly actually had their resting heart rate go way down, or their resting blood pressure rather go way down. So 2 more things. So 1, you can squeeze your inner thighs together. 2, you can take one of these, like a lacrosse ball or a tennis ball or a stress ball or whatever it is, and squeeze it. So a hand grip study is one that they did, and you can squeeze it for up to 5 minutes. This also helps lower your stress as it lowers your blood pressure. And then you can, if you're feeling really courageous, hop on the floor, get in that plank position. You're just in a push-up position on your forearms and hold that. And you can work up to holding that for longer and longer. It's ideal to maybe start with like 30 seconds. But yeah, isometric exercises. So you're not actually moving. I'm not even lifting an actual finger. I'm just squeezing. But when done in repetition over time for about 10 weeks, which if you're watching this live, it's October 22nd. By Christmas, your blood pressure could go down. Even during holiday season, your blood pressure could go down by Christmas if you start today, right now. So again, something as simple as squeezing your thighs together, pressing down or up on your desk at work, and planks, squeezing a ball with your grip. All these things are good for your muscles, great for your heart and your blood pressure, and don't take much work at all. They're happy for all ages, and we're going to talk more about some Pilates exercises that are great like this for all levels, and how to use this little guy to change all of your headache and stress tension and release all the muscles in your body this Saturday at 1 p.m. in Cleveland Heights at the Somatic Center. So please RSVP and register for that event, and we will be happy to see you there. Otherwise, I hope your blood pressure is lowered just by listening to these fantastic, easy tips and tricks, and that you're having a great day.